Okay, good evening, everyone. It's a pleasure to have us again on today's Safeoclock Health and Safety Interactive Workshop. My name is Johnson Wall, and I'm glad to have us to discuss this topic for this week. So as our culture has been, we'll start with a brief presentation, which after the presentation, it will be time for us to share our knowledge and discuss our experience and ask questions if possible, and those who are knowledgeable enough can answer those questions. So this week we are discussing the Legionnaires Disease, and we are focusing on the workplace, how it affects the health and safety of the workers, and the risk, the control measures, the effects. So these are the things that we are discussing today. So we'll look at some of the symptoms, we'll look at the risk, we'll look at the treatment as well. And we'll also look at how it's contacted as well. So what is a Legionnaires disease, or what are Legionnaires disease? It's a severe form of pneumonia that affects the lungs and is caused by a bacteria known as a Legionnaires. So this bacteria, when it gets into the body through an infected water, it comes in form of with pneumonia symptoms. Okay, so that's why I said it's a severe form of pneumonia, because the same bacteria that causes pneumonia also causes this Legionnaires disease. So, but it's a bit severe, which simply means some of the symptoms are more severe than common cold or common pneumonia. So Legionnaires cannot be transmitted from person to person. This is another difference that differentiates it from the common cold or common pneumonia. It cannot be transmitted from person to person, but the same source that infected someone can also infect another person, but not from human to human transmission. So it's gotten through inhaling tiny droplets of waters from this any water that is infected by this Legionnaires disease. Where the bacteria is found in warm, stagnant water. Those water in the workplace that are stagnant, and due to temperature, they become warm. So this bacteria breeds in that type of environment. So the water from maybe AC, or the water from cooling systems, the water from tubes. So these are where this type of bacteria breeds. Now, Legionnaires disease is a bit serious, but in some cases, it can also be fatal, in the sense that in some cases, if not treated immediately, it can be fatal. It can lead to loss of life. So, but there are some people that are at high risk, which we are going to be looking at, those set of individuals that are at high risk of fatality or more serious outcomes due to exposure to Legionnaires disease. So how does people get infected with Legionnaires disease? So it could be through a building ventilation system, like water from the AC system, or it could also be from hot tubes. It could also be from air conditioner systems in your cooling towers. It could also be from heaters or from hot water tanks. It could be from fountains. It could be from drinking water fountains, from childbed pools, or public showers. So those pools of water that most times they are stagnant, and in most situations they become warm. So this Legionnaire bacteria breeds in those locations and in those places, and the droplets of those waters getting inhaled by any human or any person gets this disease instantly or immediately. So how does it get into the human body? It goes through aspiration. So in some cases, this water can enter into your system unknowingly. The water can enter into your system unknowingly, so it becomes, you get infected without knowing it. Okay, so or through the soil, somebody can get infected by getting exposed to those infected soil, maybe during cultivation or in the farm. So those soil that has absorbed those infected water, and you get exposed there. From there, it gets to your body, and you get infected with Legionnaires disease. So these are some common ways of getting this disease. In the workplace, we know different locations, maybe especially during the rainy season or even outside the rainy season, there are some locations whereby we have stagnant water that are not well cleaned, even in sewage areas or in confined spaces. So these are high-risk areas where Legionnaire bacteria can breed, and workers getting exposed in those locations make them at high risk. So that is why we are looking at this today, to see how we can control them and improve the awareness. So there are people that are at high risk. Like I said from the beginning, that some people are at high risk of exposure to this disease due to maybe some of the outstanding or initial health conditions that they have, or some of their health habits or health situations. One of the people are smokers. Those people who smoke, that their lungs are already compromised, they have an increased chances of getting infected with Legionnaires disease. Another people are those people who have compromised immune system, like those suffering from HIVs, those suffering from hepatitis. So those people that their immune system are already compromised are at high risk of contracting this Legionnaires disease. Another people are those people who are suffering from major illness, like chronic lung diseases, those people suffering from diabetes, kidney illness, or people suffering from cancer. So you see that these people, they already have compromised immune system, and they can easily get infected with this bacteria. Also, people who are above 50 years of age. So those people are also at high risk due to decreasing immune system as someone gets older. Now, in hospitals and in old people's home, you see that they can easily transmit these germs due to their compromised immune system, due to their ill health that they're already suffering. So at those locations, they can easily get infected with this disease if they get in contact with the infected water. So what are the signs and symptoms of exposure to Legionnaires disease? The first one is headache. It says that it starts with headache. Most times it starts with headache and it goes to muscle aches. The person will start feeling feverish, having a temperature over 40 degrees centigrade. It can have fatigues. It can start feeling chills. So if not treated, on the second to third day, the person can develop other symptoms such as coughing. He will start coughing. He will start having shortness of breath. He will have a chest pain. He can have a gastrointestinal symptoms, and he can have diarrhea. If not treated, and as the days goes by, he can start getting confusion and other mental changes, and he will start having fatigue. And if nothing is done adequately or promptly, he can fall into convulsion and maybe lead to death as well. So that is at the later stage that we said before that Legionnaires disease can be fatal if not treated adequately and promptly. So how is it diagnosed? Diagnosing Legionnaires disease is similar to how you diagnose other respiratory disorders. It's diagnosed through laboratory tests. The healthcare practitioners, they can use the normal blood routine examination test to diagnose Legionnaires disease. They can also do that through direct fluorescent antibody staining. They can do that through sputum culture test. They can do that also through urine antigen test. They can do that through liver function test, through serum electrolyte level test also. They can do that also through arterial blood gas testing, even through blood oxygen saturation, or as well as chest x-rays. So these are ways that the healthcare practitioners can use to diagnose Legionnaires disease. So what this simply means is that as health and safety professionals, it's not our job to diagnose this disease. So even if you suspect or maybe those symptoms that we have mentioned are there in the worker, so the right thing to do is you can suspect this, but you need to send them to your clinic. They have to run any of these tests or any of these specifications to check if this is what is suffering or not. And medications and treatment should commence immediately. So how do we prevent Legionnaires disease in our workplaces, even in our homes as well? How do we prevent getting infected by Legionnaires disease? The first one is that you should avoid swimming in tubes, especially when those water are not properly treated. In swimming pools, maybe public swimming pools or private swimming pools, they are regularly treated. They maybe once in a week or so, they remove the waters and treat them with chlorine before refilling the waters again. So, but those tubes that the water is not removed, it's been there for a long time, and the water is not adequately treated. So we should avoid swimming in those type of pools or in those type of hot water tubes. Then we should avoid showering in hot water that is not properly heated. Now, what this simply means is that the Legionnaires bacteria can get in stagnant water heaters. The water heater tubes can accommodate these Legionnaires bacteria, and if you use this water from your heater without properly heating it up, so you can easily inhale any of these bacteria while you are showering. So after heating it up properly, then you can be able to dislodge or maybe kill some of the bacteria. But if not properly heated, if there are Legionnaires bacteria trapped in your heater or bath tubes, so you can easily get infected through that process. Now, if there is any building or any location that has been confirmed to have an outbreak of Legionnaires disease, we should avoid going in those locations, because you never can tell the location where those stagnant waters or maybe where the Legionnaires bacteria is located. Also, we should dispose all those stagnant waters properly. Not just like your AC water that has been trapped or stagnant for a very long time. Don't just throw it in front of your house. You should suspect that some of these Legionnaires bacteria could be trapped in those stagnant water. So it should be disposed properly, and wash your hand very well after that, so that you will not infect, you will not unknowingly infect yourself. Then if the Legionnaires disease you suspect gets serious, you need to visit your doctor. Your doctor will give you some antibiotics to be able to prevent it degenerating to higher symptoms. So how do they treat Legionnaire bacteria or Legionnaire disease? These are left for medical practitioners. So our own as health and safety professionals, if you suspect this symptom in any of your workers, make sure you send them to your clinic or send them to the hospital. Let them get adequate treatment and adequate care before returning to the workplace. And when they're in the hospital, anybody visiting them should take adequate precaution, take adequate care so that you not easily get affected. Okay, so this is the little I have to share through my slides. And as our culture has been, we open the floor and let others contribute to the topic.
Okay, let me chip in briefly because my phone, I'm having a flat battery because of I had some situation that for some days now I hardly charge my phone before I get to the office, and I don't move with my charger. So it's unfortunate, but like I said, briefly, I would just want to say one or two things based on, I want us to look at the health and safety responsibilities and also an emergency response, where we can come in as health and safety, So, from the employer side, with we being employed as a professional, we need to find a way to assess the risk of such disease or bacteria in the workplace, within a workplace that involve water systems, and these things are also common when you are working within the facilities, within a facility building. And also we have to identify any source of susceptible, you understand, any source that have this pattern of susceptibility, so especially like when you look at the cooling towers, looking at the hot and maybe cold water storage area. So these are critical area of sources that this thing can happen. Okay, like in a facility where they use the chiller, the chilling system and all that, So, and also we need to look at a way of appointing somebody who is responsible for managing this risk within the workplace. And also we should ensure that there's a regular maintenance and inspection of any source of water system within where we are working. Okay, and also not just having an inspection record, as part of the requirement, we have to maintain and have a record for this maintenance and also checking the temperature, because the temperature of the system will also determine if such system will be prone to this Legionnaires disease. Okay, and also by requirement, if there's any suspected cases, it should be reported, So for the control measure, we need to look at regular temperature control. Okay, at least every water should be stored above 60 degrees and should be distributed within 50 degrees, and also for any water that is cold, we must ensure that it's between or below 20 degrees centigrade, So anything that makes it deviate from this will be it will be prone to such disease. Okay, so and we should also ensure that the systems are regularly clean. There must be a cleanness within the system in order to because when you clean it, there's what we call descaling. You descale the system and remove of dead legs, unused, like when you look at pipes that are not used, any drain pipe that are not frequently used or frequently cleaned. So they tend to store some kind of dead legs. They call it dead legs. So in that area, when there's a quantity of water settled in that area without flushing another, so such kind of bacteria is likely to build up in such area. And once water now passes through, it will flush it into the system that everybody will begin to inhale and will create problem. So that is why it is good to check air quality as well, because from the chiller system, it brings out the cool air and all that. We inhale it in the public space, and at the end of the day, people can get infected. So, and also it's good that, in a big facility, we also treat the water. Water treatment is very, very important. You have to treat either using chlorine, biocide, or bromide to minimize the bacterial content within the water storage. Okay, so routine monitoring is very important by checking the temperature, like I've said earlier, and also when needed, and sometimes we need to take the water sample for tests to test specifically for some certain kinds of bacteria like this Legionella. It's very important. And for emergency situation, as an health and safety professional, it's we need to inform if any staff has been infected, with such this thing by carrying out series of tests, and so a kind of disinfection practice within the source of where this water is coming from. And if anything happen, any identified case, depending on your jurisdiction, if it's in a place that is well developed, you have to report this case to relevant authority and also conduct some form of environmental testing and review your internal control strategy as an organization in order to manage such situation when it comes. So I will just leave this at this point. I have 2%, so I'll have to leave you guys, but I believe my contribution is valuable to the group. So
Thank you very much. Thank you very much, Mr. Stephen, as always, for your valuable contributions. We really appreciate. Okay, so let's hear from others.
Okay. Good, how do I say, good afternoon from here and good evening there. My name is Eddie. The first speaker I've made justice to all what I wanted to say. Mostly I wanted to talk about risk assessment. I'll recall there was a time I worked somewhere, I think in Iraq, yeah, that was it. So people were falling a bit sick and all that, especially the white guys. I hope we don't have any Oyibo here in the midst. I don't want to call because sometimes it can be offensive calling them Oyibo a white guy. So they had to, in fact, some people started raising alarm that maybe it is someone saw mole, something like a mole in his room, very tiny mole like this by the bathtub. That was it. Then why am I saying this? It linked up to Legionnaires too. So a lot of things came up. In fact, the reaction was that the person ran out of the room, created a scene, and all that. It became a very big deal because people were falling sick that period, which had to make us sit back and review our risk assessment. That's what I'm going to risk assessment review. Most times we don't really look at such things in our risk assessments. No matter where we are, maybe we don't think it will happen, but over a period of time, especially on facilities, especially facility management companies, you need to always include those things, even if it has not happened. What if it happens? So that if you embed them in your risk assessment, that means you should also have SOP work instruction on how to ensure that you be proactive and put preventive measures through preventive maintenance, flushing those your HVAC cooling system, and cleaning all those things, cleaning your water system, ensuring you maintain the right temperature for it. So my main point now is let us always consider this during our risk assessment. This is very, very important. Thank you, and thank you for what you are doing, Johnson. We really appreciate it.
Thank you very much, Eddie. Thank you for that wonderful contribution. That reminds me, even in those of us in the construction industry, most times we only focus on the safety aspect in our risk assessment. And you hardly see people look into the health aspect in the risk assessment. Even in our welfare facilities, like the mess hall area, the workers' toilets, you find out that those places are also prone to Legionnaire breeding. So these are areas, or these are some of the things that we should also put into consideration. During our inspections, most times we'll go to, we focus in the workplace, we focus on the safety side. We don't even inspect the welfare areas. We don't look at stagnant waters. You see some areas where they have this window AC that will be dripping water out also in the site. And maybe there is a bucket where they used to collect those water. It stays there for months, even for weeks. And we don't bother to look at what could breed, what type of bacteria could breed from this type of accumulated or stagnant water. So this is also a call of duty to us to look inwards to the health part of our health and safety. We are answering health and safety, and we are focusing only on the safety side. So it's a call of duty to us as well. So thank you, Ms. Adi, for bringing up that. Let's hear from others while we still have some time.
Hello, sir.
Yeah, go ahead.
Good evening once again.
Good evening, sir.
Yes, it's quite an interesting one. Hazard, interesting in that it affects all of us. As a matter of fact, I work in a facility management company where you see hygiene is top notch, and going to this fact, our workers here, before they enter into the food production areas, one of the major things that they're supposed to do is to make use of a nose mask, as well as making use of anything that will infect food. So on the long run, in my company here, food is not exposed. But around the facility here, we have cold storages that you see, if care is not taken, people can pick infection, pick a disease from this. Because I know what you have said also, that this disease easily thrive where the temperature is conducive for organisms to grow. So the temperature you quoted, 25 and above, of course, that's true. You find out that if even the room temperature that we have in the various houses, this temperature can cause or can encourage the growth of this gem. So it's a new one for me, and I think it will help me in making sure I add it to my risk assessment. I haven't really thought of really putting it into my risk assessment. So apart from that, most of the time, mostly in this part of the world that I'm from, you see, when you are faced with one condition or the other, people say it's typhoid, it's either malaria or typhoid, and you see, not knowing that there are other infections, because in the field of medicine, rather that in the infections that pertains to man, they are very wide. For the fact that we have different races, for the fact that we are many in number, so the way we are many in number, that's the way diseases are also many. So it's a good one for me. It's something that I really think it will help me in bettering my risk assessment. Like you said, Mr. Obina, of course, you find out that most of the time in the field of safety, we most of the time concentrate on the safety aspect, forgetting that it is health and safety. Even sometimes environmental, most of the time, is relegated to the background. So it's a clear call on all HSC professionals that there's need for us to put into our risk assessment diseases or ailments that pertains to the kind of job that we do. Understand? It is very, very important. Apart from that, too, we also found out that one thing that we all as human beings have been given to fight against infection and disease is the immune system. So most of the time, this is a defense mechanism that help us to uh, to to ward off things that would have caused infection. You understand? So, but that doesn't mean that because of that we'll still will live a reckless life. So it's a clear call on all of us as case professionals to make health part of our HSC. You understand? So it's a nice one. I really appreciate you guys for this topic. It's a good one. You guys have a nice day. Thank you.
Thank you very much. Thank you very much, Mr. Mojede, for a wonderful contribution.
Okay.
Go ahead, Henry. Go ahead.
No,
Mr.
David
David will
Austin
come
talk.
to you.
David Austin talk.
Okay. All right, David, go ahead.
Yeah, good evening, all. I'm happy to be here once again. It's a very interesting topic with a lot of insight. This topic made me to recall and flashback on some recent happenings in the construction site where I actually work. Okay, there is this drums of waters that are placed in the construction sites, which after the activity, they tend to neglect it there for a long time. And sometimes there's a popular belief, maybe it's a cultural or traditional belief, that water does not have enemy. Okay, so people tend to use water for whatever they like, believing that so long as it is water, it can bring no harm. So this water might be there for months, and then when they later come back there to carry out one or two activities, like maybe after their masonry work or plaster work, they tend to use this water to wash their faces, their legs, their bodies, and whichever they do that, I know that this water tends to get into their system in one way or the other. So this is a wake-up call for us to emphasize on the need to dispose or prevent stagnant waters in the sites, which can promote the spread of this Legionnaires disease. So it's a very insightful topic, and I'm happy I'm a part of it. And I will try to push to implement that health is being incorporated in our work, not only the safety aspect. Thank you.
Thank you very much, Mr. David. I really appreciate your contribution. Swemba, go ahead, sir.
Okay. Can you hear me?
Yes, can hear you, sir.
Okay. Good evening, all. The truth is that I'm not too familiar with this Legionnaires disease. So to be very honest, I'm hearing this for the first time. I'm hearing it for the first time. And I quickly looked at it at Google and checked to understand what it's all about. And I see two things. One, this Legionnaires disease is kind of very, very, the symptoms that comes with it is very, very, so much like the normal typhoid fever thing we have, because I am seeing cough, I'm seeing headache, I am seeing muscle aches and the rest. So it's one has to be very careful. Yes, like you said earlier, when we suspect, as HSC people, what that somebody is having this kind of disease, I think we should also follow up to see that the person is tested, and if it comes out that it's Legionnaire, we should be sure that it is Legionnaire disease and not other disease, so that we will know, or the medical people can advise on how to treat. Why am I being particular on this? I'm using a personal experience because of my mother. My mom, some years back, she's late now anyway. She went to the hospital and she was diagnosed of asthma. And for over 2 years, she was taking drugs concerning asthma, until the day she became tired of drugs and she was very weak and she could not continue again. She now told us she was tired, that she wants to die, she wants to go and all that stuff. And then we took her to the hospital, and well, let me not bother you with the whole story, because at the end of the day, she died. But before she died, we started doing series of tests and all that. Personally, I didn't even know that I could be a very good medical student like this, because I started researching here and there, trying to see how I could get what to save my mom and all that. But the highlight of everything was a cardiologist who came and performed a test. And then he later called me and told me that what is disturbing my mom is not asthma. What was disturbing my mom was what they call pulmonary lung disease, PLD. That disease can be confused or contradicted for asthma because they have the same symptoms. So any medical person must have made this mistake. The doctor that must have made this mistake, that in the world of medicine is forgiven, because they both have the same symptoms, very similar, but they are different things. So why am I saying this? My mom was treating asthma. Meanwhile, it was PLD that was disturbing her. So you can imagine the extent of damage the drugs would have done. So I'm looking at this Legionnaire. The symptoms are similar to other common respiratory tract disease. So one should be very careful to know what is really wrong with you, so that you don't go treating something else. Or for instance, you have these symptoms and then you say it's typhoid, it's typhoid. You go treating typhoid, you go treating malaria, not knowing that you have Legionnaire. So yes, like the moderator said, as HSA persons, when we are at site and we see people who are having such symptoms, yes, we cannot diagnose. We can only help the person get some medical treatment. But also, we should try, as a part of duty to care, to ensure that these people follow up until the last quarter, follow up until proper diagnosis is made, to be sure that what we are suspecting is what it really is. We should not allow them halfway at the end of the day to start taking medications that may further complicate the issues because they don't know what they are treating. So that's one part I wanted to really make sure. Another part is that environmental procedures, environmental actions are also a call on this very disease. Why? Because if you look at it, it has a two-way infection, tract infection, water and air, a two-way tract infection. And then when you look at the causative agents, or if you look at those areas where they are caused, you see, you looked at poor water treatment, poor water storage, lack of fumigation around, So fumigation is one thing that can help. If we have the money, we can be fumigating our houses, both indoor and outdoor fumigation. It's one way that it can help to curb this. Also, disposing of unused water or wanted water in containers around the house can also help. It is not now we have seen that this water does not only promote mosquito breeding. There is a new guy in town. He is called Legionnaire. So we have to also fight against that by disposing all those containers, especially that are not properly labeled with water, or with the content. We don't know which content it is at our work site, where we see different containers with water looking fluids inside. We don't know what it is. So we should be able to, one of the things that should be in our risk assessment should be that all containers that are containing fluid should be labeled. We should know what is inside, so that we can tell if this is water or this is a different fluid. It's very, very important. And then lastly, I think I believe one sure way we can control this is this outbreak of Legionnaires disease. It can be prevented by monitoring and cleaning water systems. All water systems. By water systems here, I mean drainages. I also mean the showers, the bathtub, the bedrooms, and the rest. So it is one sure way of doing it. By monitoring and cleaning this system. Participate in environmental sanitation around your house. Make sure no stagnant water around. Make sure that these things are heated. If you want to use the heater, it is heated at the right temperature. And at the end of the day, if we do all this, we will ensure that we are preventing this Legionnaire disease to a lowest reasonable uh, uh, point that we can control. So thank you very much. This is a good one for this topic. It's a good one for me. Thank you.
Thank you very much, Mr. Swemba, Dr. Professor Swemba. We really appreciate your contribution. So, do we have any further contribution?
I just want to add a voice to yes, I would just want to add a voice to what Mr. Swenkba has talked about. Yes, I want to add a voice to what he has said. What he said is really true as regards what the mom passed through. You see, as safety officers, it's good we come to understanding of the fact that if we are not properly diagnosed for a particular infection or disease, we should not treat. You see, in the world of germs, what they tend to do if we use drugs indiscriminately is that they tend to have something to call uh, 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 plasmids, and these plasmids are a kind of a jacket that they put on themselves, such that if you want to treat a person that has certain infection again with other kind of drug or a higher kind of drug or the same kind of drug, it will not work. So, and we should have an understanding also that these antibiotics or drugs, they are poisons ordinarily. So if we are not facing an infection, if we are not being diagnosed for a certain condition, we are not supposed to use drugs. Resistance to drug resistance microbial resistance to drugs are owing to indiscriminate use of drugs. So it is very, very important that before we take a certain prescription, we are diagnosed by recognized medical practitioner. As they said, yes, this is a real infection with the symptoms and signs that the person has displayed before the treatment is being given to the 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 the, the, the person. So that's my little contribution. I just want to add to what Mr. Henry has said. Thank you.
Thank you, Amajede, for re-emphasizing that. That is very, very important. Thank you so much for that wisdom you shared there. All right, we are rounding off. Do we have any contribution more before we round off, because we are already past 7? Okay. In the absence of that, I want to appreciate us for lending our voice to this topic today. Though the notice for the topic came late, but we responded very, very well. So I really appreciate us. So thank you guys for joining today. And next week, we'll meet again by God's grace. All right, have a nice day.
Yeah, thank you. Bye, sir.
Thank you. Bye.
Thank you. Bye.